Thank you, Michelle, and get well soon. And thanks to Elizabeth Solomon for the wonderful land acknowledgement. To the class of 2022, congratulations. It might feel incongruous to celebrate in the midst of a global pandemic. As Michelle listed off all the crises you might address in your careers, I myself started to feel a bit overwhelmed. I know our hearts grow heavy when we think of the senseless shootings yesterday at Robb Elementary School in Uvalde, Texas, and earlier this month at Tops Supermarket in Buffalo, New York, and the Taiwanese Presbyterian Church in Laguna Wood, California. Gun violence is surely among the top public health issues that we collectively must face. But even as we mourn the deaths, standing here today, seeing all of you in cap and gown, my overriding emotion is one of optimism. I'm optimistic because I know that all of you will be a driving force, an unstoppable force in building a healthier and better world for everyone. The class of 2022 represents 46 countries from Mauritius to Mexico, South Korea to South Sudan. 40% of you came to Boston from outside of the United States. It's been a beautiful thing to watch this international community come together to wrestle through some of the toughest public health challenges, sharing perspectives and challenging each other's assumptions as you work towards solutions that will save lives around the world. You've investigated how factors like access to housing and education shape health outcomes for people living with HIV/AIDS in rural Nigeria. You've worked to help improve access to syphilis treatment and diagnosis for pregnant people in Brazil. And you've built a mobile app that will help refugee women all over the world take health into their own hands. My hope is that you'll continue to work together on these problems long after you leave this campus, that even as you disband as classmates, you'll consider each other lifelong partners in a global effort to improve health. As most of you know, we lost a giant in the public health community this year who embodied this ethos, Harvard's own Paul Farmer. A physician by training, Paul dedicated his remarkable and all too short life to improving healthcare for the most vulnerable people in the world, in places like Haiti, Sierra Leone, and the Navajo Nation. And he did it all with an enormous sense of empathy that came from embedding himself in the communities he served so that he could better understand his patients' needs and their lives. Paul knew how to effect change, even within some of the world's most deeply entrenched systems. And in 2012, he shared with another graduating class the secret to his success. With rare exceptions, he said, all of your most important achievements on this planet will come from working with others, or in a word, partnership. 10 years and one pandemic later, his message still resonates deeply. If COVID-19 has taught us one thing, it is that public health is global health. As UN Secretary General Antonio Guterres put it in May of 2020, in an interconnected world, none of us is safe unless all of us are safe. We believe that kind of safety will only be possible if we take on a more global approach to problem solving. Take the discovery of the Omicron variant of the SARS-CoV-2 virus in Gaborone, Botswana. Sikulile Moyo is the director of the Botswana-Harvard AIDS Institute Partnership Lab, a long-standing collaboration between the Botswana government and the Harvard Chan School. When the pandemic began, the lab was able to quickly pivot to test for and sequence COVID-19. In mid-November, Dr. Moyo noticed an unusual pattern developing while sequencing COVID samples, a number of mutations that looked very different from the Delta variant that had been circulating for months. He shared his findings with colleagues across the border in South Africa. They too found the new sequence in their local samples, and they quickly alerted the rest of the world that this new, highly contagious variant was on the move. Now just imagine what would be possible if that kind of international public health partnership was the rule and not the exception. If that kind of health infrastructure existed in every country around the world. That would require us to invest in places that have traditionally been ignored, or worse, places that are too often thought of as the source of the problem rather than as part of the solution. And that is exactly what we must do. Because in this globalized world, a handful of rich countries cannot be the only ones with equipment, resources, and agency to sequence viruses or manufacture vaccines or make new discoveries. And that kind of sea change in how we approach public health, that is going to be up to you, our next generation of leaders. It's up to you to make sure that what we've learned in this pandemic isn't quickly forgotten, that your work isn't confined to disciplines or sectors or borders, that you seek out and invest in ideas from all over the world. Over the next few decades, many of you will be part of developing the solution to the public health crisis that is climate change, and I hope you'll apply the lessons of this pandemic. As the father of environmental justice, Dr. Bob Bullard says, the populations in the communities and nations that have contributed least to the problem feel the pain first, worst, and longest. These communities are also leading the charge towards a solution. In fact, a recent article in Nature called the Global South the climate movement's unsung leader, despite the fact that it emits only a fraction of the world's greenhouse gases. Coastal communities in Africa are building seaweed farms to capture carbon, a powerful ocean-based innovation that comes with the added benefit of new jobs and food sources for local communities. Farmers in countries like Brazil are implementing micro-irrigation techniques and other more resource-efficient ways to grow food. And in the face of population growth and resource depletion, many countries across the global south are investing significantly in reproductive health services and seeing higher adoption of voluntary family planning as a result. But as with any crisis of this magnitude, we're not going to solve climate change without deep partnership between and within North and South, between academia and government, between NGOs and the private sector. These public-private academic partnerships are absolutely essential. What we do and whether we do it together will set the course for human health for the next century and beyond. I'm going to share an old quote from our keynote speaker, Dr. Mamphela Ramphele. "My journey is the journey of a searcher who never gives up dreaming of a better tomorrow," she said. Many of us here at this ceremony share that restless, determined, steely-eyed optimism. And perhaps more than any other class in a generation, the class of 2022 is ready to meet the challenges and opportunities of this changing world. No matter what direction your career takes you, we feel confident that you have everything that you need to think critically and find solutions to our most complex problems, not the least of which is a group of smart, capable collaborators from 45 other countries around the world and counting. So thank you, and again, congratulations.